You know that feeling? The throbbing right here, in the base of your skull? Your chest feels tight, your face feels hot, and you just know your numbers are spiking. It is a scary feeling, but I want you to know you don't have to be a victim of that spike. In the next 8 minutes, I'm going to show you exactly how to lower your blood pressure immediately, right where you are sitting, using 2 scientifically backed methods. We're going to use a specific rhythmic breathing pattern and something called somatosensory modulation, which is just a fancy way of saying acupressure. No medication required for this specific drop, just your breath and your hands. Let's bring those numbers down right now. First, we need to understand why this is happening so you can stop it. When your pressure spikes suddenly, it's usually your sympathetic nervous system taking over. That's your fight or flight response. When stress goes up, your vagal tone goes down, your heart races, your vessels constrict, and the pressure builds. We need to manually flip that switch back to rest and digest. Now, a quick reminder. This is for immediate relief of a spike or stress. It is not a cure for chronic hypertension, and if you have chest pain or stroke symptoms, please call 911 immediately. But for that daily stress spike, this is your toolkit. Method 1, the 4-7-8 breathing technique. Let's start with the natural tranquilizer. It's called the 4-7-8 breathing technique. You might ask, why those specific numbers? Why not just take a deep breath? Here is the secret. Your heart rate typically increases when you inhale, and it decreases when you exhale. By extending your exhale to 8 counts, double the length of your inhale, we are physically forcing your body to slow down your heart. And that 7-second hold in the middle, that builds up a tiny bit of carbon dioxide in your blood. That might sound bad, but it's actually magic. That extra CO2 opens up the blood vessels in your brain and acts as a mild sedative. Think of it this way. Imagine you're sitting in the doctor's parking lot. You're terrified of the cuff reading, classic white coat syndrome. You can't exactly drop down and do push-ups to burn off stress. This technique is stealthy. You can do it right there in the waiting room. By the time they call your name, you've shifted from panic to peace. Enough talking. Let's do it together. Sit comfortably, back straight. Here is the pattern. Inhale through your nose for 4, hold it for 7, exhale forcefully through your mouth, making a whoosh sound for 8. Ready? Let's go. Inhale nose, 2, 3, 4. Hold it. Relax your shoulders, 5, 6, 7. Now whoosh it out. 2, 3, 4, 5, 6, 7, 8. One more time. Inhale nose, 2, 3, 4. Hold. Let the tension melt, 6, 7. Exhale mouth. Make it loud, 2, 3, 4, 5, 6, 7, 8. How does that feel? A little lightheaded? That's normal. That is the tension leaving. Even a 2022 study showed that doing this improves heart rate variability, which is basically a score of how relaxed your heart is. Method 2, acupressure, the physical override. Now, if the breathing isn't enough, we need a physical override. We're going to use acupressure to hack the nervous system. We're stimulating specific nerves that send a signal straight to your brainstem to say, hey, turn off the alarm. The first point is GB20, or the wind pool. It's right here at the base of your skull, in those little dips between your neck muscles. We've all had that deadline headache, that tight band wrapping around your head after staring at a screen for hours. That isn't just pain, that is your sympathetic nervous system screaming at you. Take your thumbs, find those dips, press firmly. You should feel a dull ache. That's good. Hold that for 1 to 2 minutes while you breathe. This is one of the most effective points for urgently lowering pressure. Point 2, LV3, the red face point. Next, we go all the way down to the feet. This point is LV3, or great rushing. It's on the top of your foot, in the valley between your big toe and your second toe. In traditional medicine, they call sudden high blood pressure liver yang rising. Think of someone in a heated argument. Their face turns beet red, veins popping. If you ever feel that heat rising, maybe you just got off a stressful phone call, this foot point is designed to pull that energy down. It grounds you immediately. Point 3, LI4, hand and warning. The last point is the easiest to find. LI4 right here in the webbing between your thumb and index finger. Pinch it hard. It releases endorphins that relax your whole body. But listen closely. If you are pregnant or think you might be, do not use this hand point. It can induce contractions. Stick to the breathing and the neck point. Safety first. So here is your emergency protocol for the next time you feel a spike. Sit down, close your eyes, apply pressure to the neck point, or GB20, or the hand point, LI4. While you're pressing, do the 4-7-8 breathing. Do that for 5 minutes. You will feel the shift. Now, this video was about immediate relief, but if you want to keep your pressure down long term, you need to address the root cause with simple daily exercises. If you're looking for a natural way to do this, I highly recommend exploring the Blood Pressure Program by Christian Goodman. It takes just 9 minutes a day. These are the first mind-body exercises specifically designed for high blood pressure. They target the medulla oblongata, the part of your brain that controls blood pressure, focusing on calming it down to naturally deflate the pressure. I've left a link right in the description below, so click there to learn more. Breathe deep, and I'll see you in the next one.